Our ancestors' diets were rich in the essential vitamins, minerals, and phytonutrients needed for optimal function. But today, thanks to declining soil quality, a growing toxic burden, and other challenges in the modern world, most of us are not getting enough of these critical nutrients. That's why I created Adapt Naturals. It's a supplement line that closes the modern nutrient gap so you can feel and perform your best. Unlike most supplements that contain cheap synthetic compounds your body can't absorb, we use clinician grade, bioavailable ingredients that make a real and noticeable difference. I've translated 15 years of experience treating hundreds of patients and training over 3,000 healthcare providers into a supplement line you can trust. No BS or hype, just high quality, research backed, clinically validated products that get results. Our supplements are made without gluten or GMOs. They're also third party tested to validate ingredients and confirm they're free of heavy metals and other toxins. We have a full range of products, from the most advanced multivitamin and phytonutrient formula on the market to a blend of 8 organic superfood mushrooms, including reishi, chaga, and cordyceps, to a one-of-a-kind fish oil with bioavailable forms of curcumin and black seed oil. Our newest product is Luminous Mind, a blend of 7 nootropic compounds that boost cognitive function and elevate mood, including citicoline, UMP, bacopa, ginkgo, and lion's mane mushroom. These nootropic ingredients improve focus, memory, and attention, boost motivation and mood, and promote emotional and psychological resilience. They do this without the jitteriness, agitation, and sleep disturbances that often accompany caffeine. They also support brain health by protecting neurons, promoting neuroplasticity, and even regenerating new brain cells. Luminous Mind's a perfect fit for students, knowledge workers, entrepreneurs, creators, artists, people under mental or emotional stress, and those struggling with cognitive issues, low mood, and difficulty focusing and concentrating. I think of it as an unfair advantage that can help you achieve your goals, whatever they may be. Head to adaptnaturals.com to learn more and start living the life you want to live. Hey everyone, Chris Kresser here. Welcome to another episode of Revolution Health Radio. It's an incredibly difficult and trying experience to receive a cancer diagnosis for your child, but that is compounded by the fact that there are very few integrative or holistic options available for treatment. Or put another way, there are very few clinicians out there who take an integrative or holistic approach to pediatric oncology. So for parents who want to pursue that as an approach, there just isn't a lot available. And that's true even if you're willing to leave your local town and see a practitioner out of town or work with somebody virtually. So I'm really excited to welcome my guest, Dagmara Beine. She holds a PhD in integrative medicine and initially worked as a physician's assistant in emergency medicine. But after her daughter's cancer diagnosis and subsequent fights against acute myeloid leukemia, or AML, which is a rare and quite serious form of leukemia, she transitioned into integrative pediatric oncology and now supports families and children who are dealing with cancer diagnosis to take a more holistic terrain-based approach to recovery and post-cancer recovery. So in this episode, we talk about her new book, which I highly recommend as a resource. It's called A Parent's Guide to Childhood Cancer, which is now out. We talk about what contributes to cancer diagnosis in children, how we can better support conventional treatment, what can be done after conventional treatment has concluded, and then what some of her favorite tests and tools are for supporting cancer treatment in kids. I really enjoyed this conversation. I think it's absolutely critical work that Dagmara is doing. We need much more of it, and I hope you get a lot out of it as well. Let's dive in. Dagmara, it's a pleasure to have you on the show. Welcome.
Thank you so much. It's an honor.
So I'd love to chat a little, start with your background, so talk a little bit about that. So you have a PhD in integrative medicine, but initially you were a certified physician's assistant working in emergency medicine, which is pretty far from what you're doing now. So
Yeah.
talk a little bit about how you made, what led to that transition in the first place and how you made it.
Yeah. So I was working as a physician assistant in the emergency department, which actually was a phenomenal background to have because I got to experience a little bit of a lot, right? So anything from your heart attacks to like runny noses because everything comes in through the ER. And I was in the ER for about 10 years when my then 3.5-year-old daughter was diagnosed with a rare form of leukemia called acute myeloid leukemia with a fairly poor prognosis. And so I was in medicine, but I definitely did not know anything about the oncology world. And just like every other parent or really anybody who gets diagnosed with cancer, my world flipped and turned upside down, and I was kind of thrust into pediatric oncology. You don't really get to take a breath. Uh, my daughter's name is Zuza. She started chemotherapy the next day, which I actually write a lot about in my book about taking pause and not doing that. And really quickly into her treatment, little things started not feeling right. It was really the kind of formula they recommended that she gets when she stopped eating and started becoming malnourished. And just looking at the ingredients of like corn syrup and seed oils, I wasn't very what I would consider holistic back then. My knowledge wasn't great, but I knew that that was wrong, and that's really what snowballed me into wanting to do everything I can for her, realizing that conventional oncology, um, they were experts in the chemo protocol or, the radiation or surgery, whatever the course is, but they were not experts in the whole person, the whole child. And so I went back to school and just started getting certification after certification. Your program was the first one that I did. So my daughter was diagnosed with cancer in 2015 and was in remission when I started your program. That was my first introduction to functional medicine. And then I haven't stopped. So I went back and trained with Dr. Nasha Winters. I got my PhD in integrative medicine. I have done everything in every conference and read every book and every mentor to be able to become the practitioner that I needed when my daughter was diagnosed and I couldn't find anybody to work with.
Yeah. I mean, that's such a familiar story, right? It's born out of our own need, whether it's a health problem that we're experiencing ourselves or something that our child or children are experiencing, and then we find what the available options to be limited or lacking in some way, and then feel motivated or driven to address that. And I think that's, speaking from personal experience there and having also trained hundreds of practitioners with similar stories, it makes sense to me that that would be a path to a vocation that is meaningful and rewarding and that also is filled with a sense of purpose because nobody knows the problems and the shortcomings in a particular area better than someone who's experienced those firsthand on from the patient's perspective. And then it gives you as the practitioner, of course, a unique ability to empathize with the people that you're interacting with because you've been on the other side of it. And I think that as difficult as your experience has been, I imagine that offers some comfort to your patients and the people that you work with because they know you understand what they're going through.
Yes, yes. And, our story unfortunately didn't end in 2015. Um, Zuza's been my biggest teacher because we've been through diagnosis, we've been through multiple relapses, we've been through bone marrow transplants. And so I keep telling her, like, we can like stop learning on you now. You can be done and healed. But yes, there just wasn't anybody that I could find that specialized in integrative pediatric oncology. There's a lot of books, and there's a lot of practitioners who specialize in adult integrative oncology. But pediatric oncology, I think a lot of practitioners are afraid to step into for multiple reasons. One of them being the medical legal kind of messiness of it all, because in this country and multiple countries, if you're 18 or under, if you get diagnosed with cancer, you have to do the treatment that is recommended or what is considered standard of care. You can't, like an adult in this country, choose to decline any of the conventional treatment or kind of pick and choose how you want to heal yourself. And so I think a lot of practitioners don't, if they don't need to, they don't want to be in that world. Plus, you're not just taking care of the child, you're taking care of the whole family, truly. And some with the child, but you're really truly taking care of mom and dad. And most of the time, mom and dad potentially may feel differently about how much integrative care they want their child to have. So it becomes something that walking through it obviously has helped me so much to be able to navigate that with other families.
So let's talk a little bit about just the state of pediatric oncology and what your experience has been working with parents who are seeking an alternative. Like, what do you see as the biggest shortcomings and things that are lacking in the conventional approach to pediatric oncology, and why is it that your patients seek you out, or at least what leads to disenchantment? And you can speak to this from your own experience, from the patient side of things, and also as a clinician, and the people that you're working with.
Yeah, so families come to me at different points of their journey. There's families more so now than ever who are more holistic. Um, there's so much more information in the last 5 years than there has ever been, maybe too much and confusing information, but it's out there. And so there's families who know from the get-go when their child gets a cancer diagnosis that they know, maybe they're families who chose to decline some vaccines, or maybe their families just to chose to kind of walk that path already, and they know that they want to continue walking that path when it comes to their child's approach to their cancer. I would say more often that's not the case. More often, the families that seek me out have started treatment and something goes wrong in treatment. So there's liver toxicity or kidney toxicity. It's not even that the treatment isn't working, it's just that their child's not doing well. And conventional oncology doesn't have many non toxic tools to help that. And it can be simple things. I mean, it can be, end organ damage. So very complex things, but it can be things like rashes and diarrheas or constipations that just more toxic medications are thrown at, like Miralax and Imodium, and then there's just more complications. So many families will seek another way at that point. And then kind of the most common, um, it's changing a little bit, is when treatment isn't working or when a child has relapsed or when they've been told that there's nothing else that can be done. And then parents really start seeking that there has to be another way. And it's very unfortunate that it works that way because just like conventional treatment is the most effective and has the best chance when the child is in the best shape and the cancer is, the smallest. It's the same way with our integrative approach. You're going to have more success with something that's stage one or the child has normal liver function and kidney function than you are when they've been through a year of chemotherapy, radiation, and surgery, and now their body's tired and they're malnourished. And but that doesn't mean that there isn't hope. It just means that I wish all families would know that incorporating an integrative approach is going to allow your child to get through treatment in a better way, right? So it's not about saying this is a cure. It's just about there's a better way. There's a better way for us to go through chemotherapy to make it less toxic and more effective. There's all these little things that we can do with the way we're eating and key supplements that can actually help your child have much less symptoms. Whether that means a cure for some families and other families, it just means a less toxic journey.
So, what's your sense of let me see how to best way to frame this. So in functional medicine, and as you know from all the training you've done, including my program, we're often looking for the root cause of a problem. So if a patient comes in, they have prediabetes and they're overweight and maybe they have, the hair loss and thinning of the outer third of their eyebrows. Like you're immediately starting to think of what some of the root
Hypothyroidism,
causes
right.
might be, right? And then you might have a conversation about their diet and their lifestyle and things like that, because we know that those are probably the driving factors in their pathology. With pediatric cancer, I've always been had a harder time applying that same lens. Now, certainly, we know from research that there are established risk factors like exposure to environmental toxins in utero, genetic predisposition, other environmental factors that can perhaps manifest pretty early on in life. But the reality is that it seems to me that there's still a whole lot we do not understand about how a child and sometimes a baby, a very young baby develops cancer. And it kind of conflicts with this idea that, we have these environmental lifestyle driven diseases that typically take decades of, exposure to a particular environmental factor before it manifests. Like most people, even if they have a horrible diet, they don't develop type 2 diabetes until they're in their 30s and 40s. Now, of course, that's getting younger and younger all the time, but it's still generally true. So I'm sure you've had a lot of time to think about this just from your own experience again, and then also in all of the patients that you're treating. So, what is your sense of this?
I'm so glad you brought this up because it is, people have a very hard time understanding, it's easy for us to understand why an adult would get cancer, right? We think about the simple things, the food they ate, maybe they smoked, maybe they drank too much, like we can make sense out of it. But when I start to talk about, and I'm very vocal about this, that pediatric cancer is not bad luck. I actually have a lot of people that get very angry because they think it's about blame, and it's not about blame. We know from studies, and definitely I can speak to my experience, that our epigenetics that we're born with and the environmental and just the state of the toxicity of the environmental factors right now together is the main cause of, I would say, most pediatric cancers. So I break it down. The way I explain it to parents is, I tell parents, if your child is a fish in a fish bowl and we take that fish out, it gets diagnosed with cancer, we take it out of the murky water and we fix it. Whether we fix it with chemo or we fix it with mistletoe or high dose vitamin C, it doesn't matter. We fixed it. If we take that fish into the same murky water, it's probably going to get sick again. And the murky water is the environmental factors. So I talk about epigenetic factors, and I have every single one of my patients do epigenetic testing. It's a really big one for me. And I can talk a little bit about further some of the most common epigenetic SNPs that I find in a lot of pediatric cancers. Blood sugar dysregulation, unfortunately, is becoming so common in the pediatric population. The toxicity, right, of our environment. So we know that especially glyphosate, but the glyphosates and the plastics and immune system dysregulation. So, all the Tylenols, inflammation, all the steroids that the babies are now using for their eczemas, some hormonal, it's like all the xenoestrogens and birth controls, and then stress and mental. So I have a patient take a quiz that helps me assess what top three factors were probably helping contribute to this child's diagnosis. And we make sure to start to work on, if it's, oh, and microbiome. So if it's their microbiome because they were a C-section baby and then they had like 5 courses of antibiotics and then, tubes, it's not saying that that's the one thing that helped create their cancer. I think of it as this puzzle, and it's just all these pieces that make a cancer diagnosis. Just like when we look at somebody's Hashimoto's disease, right? It's all these pieces that contributed to their diagnosis. Maybe it's toxins. It's the same for a child. And it makes sense when you think about the fact that when they test umbilical cord, what it has on average over 200 chemicals and toxins that we find in most umbilical cord these days. And they're such little bodies. It starts in utero. It starts with the mom. And did she detox before she even considered getting pregnant? And so with how toxic our world has become, it does make sense. And what I see the most common is key epigenetics, so these kind of hiccups that these kids have in their epigenetics that give them weaknesses to glyphosate's a big one, and toxins, and then exposures to those toxins. And I'll speak about Zuza. So I will never be able to prove this 100%, but I think Zuza, my daughter, was diagnosed with leukemia because when I was in my 20s and I couldn't get pregnant and I had a couple miscarriages, my OBGYN said to me, "Take this, you'll get pregnant." It was Clomid, and I didn't research it. I just took it. And the study's really hard to find now, and I write about it in my book. But there are studies done on Clomid that show that women who took Clomid and got pregnant, their kids had a 50% chance of having leukemia, 50% higher chance of having leukemia. So I think that planted the seed for my daughter. And then we bought our dream home behind a cornfield. And so what was she exposed to every day? And the chickens that were there, the eggs that we ate, and the garden that we had, it was all glyphosate. And so, you know, when you put these, and then I gave her Tylenol because she had fevers, and then I gave her Tylenol because my ER training was alternate Tylenol with ibuprofen, Dagmara. So when I tell this story, sometimes people will write me private messages and be like, "You shouldn't blame yourself." This is not about blame, and that's what I try to teach parents. This is about education and knowledge and knowing better. Because you know what? We moved houses, and so now we don't have neighbors that spray, and we think about glyphosate, and it's not a guarantee, but it's empowering parents with the knowledge that there are things that help contribute to most of these diagnoses. I would say maybe 5 to 10% of cancers that kiddos get, yes, they are genetic, and maybe these kids had, perfect growing up lives and were breastfed and didn't have toxins. But for the most part, I can always find contributory factors for most of these kiddos.
Yeah, it's a really important point. There's a difference between blame and responsibility. I've always been struck by just the etymology of the term responsibility, which, if you break it down, it means the ability to respond. And I might add appropriately to as a sort of hidden word there or concept is taking responsibility means being able to respond appropriately to reality as it is. In this case, like objectively being able to recognize, hey, these are some factors that may have contributed to my daughter's cancer and may still be contributing to her inability to recover, so we're going to respond to these factors in the way that feels appropriate to us, given our circumstances and ability to do that, which is very different than blame, shame, blame, guilt, shame, and blame, which in my experience keeps us stuck and unable to respond, mostly because we get stuck in this cycle of self-flagellation and blaming ourselves or blaming other people, and then that prevents a kind of clear-eyed seeing and ability to respond effectively in that situation. But I imagine that I know that that's very, I've worked, of course, with patients with chronic illnesses of all kinds. I've had my own long journey with chronic illness, and so I've seen this in lots of different contexts, and I know there's a sort of linear relationship where, like, the more serious the diagnosis, the more difficult it often is for people to decouple the guilt, blame, and shame from the ability to respond in a situation. So, is that? I imagine that's a conversation that you often find yourself in with patients and families.
Yes, and it's hard because I would 99.9, if not 100% of oncologists are saying this is just bad luck. There is nothing you did to cause this. And I know that in their hearts, they believe that, and they're trying to make the parent feel better. And they
Right.
believe in the somatic theory of cancer, which essentially
Mhm.
says cancer is bad luck. And so I try to explain to parents, we're coming from a different explanation of cancer, a metabolic approach to cancer. I explain to them what mitochondria are and how the health of our mitochondria really determines the health of us. And it's hard to make some parents understand that it's not about blame when their oncologist is saying there's nothing you did. And it's much easier to hear that, and it's much easier to not have to change everything in your world. It's much easier just to be like, "Oh, we just have to do chemotherapy and radiation, and we don't have to change the way we're eating. We don't have to change air filters in our home or where we live." I mean, it's a lot of work, and so I think for some parents, it's easier just to those aren't the parents coming to me to work with me, but I know it's much easier for some parents to just say, "It's just bad luck. My oncologist said so. We're just gonna get through treatment, and then we're gonna go back to our lives." And that breaks my heart because there's just so much that needs to be done through treatment, and there's so much that needs to be done after treatment is done. I mean, these kids, if you can just imagine what their guts look like afterwards.
Yeah, absolutely. I grew up on the beaches of Southern California and have spent a lot of time surfing in Mexico. That's how I developed a fondness for Mexican food in general and chips and salsa and guac specifically. It's one of my favorite snacks of all time. Sadly, most corn chips are made with GMO corn and fried in industrial seed oils like soybean, sunflower, or canola. As someone who cares deeply about my health, I'd pretty much eliminated chips and salsa from my diet, except for the rare guilty pleasure. That's why I was so excited to discover masa chips, a classic tortilla chip made with only 3 ingredients: nixtamalized organic corn for proper absorption, real Redmond sea salt, high in mineral content, and grass fed and grass finished beef tallow. The taste and texture of these chips are absolutely amazing, better than any other corn chips you can buy in the store. Yet they are completely guilt free thanks to the clean ingredients and healthy fats they're made with. I've partnered with Masa to get you a 20% code on your first order. Go to masachips.com and use the code Kresser20. Enjoy! I'm so excited to announce the latest product I formulated for my supplement line, Adapt Naturals. Luminous Mind is a blend of 7 nootropic compounds that boost cognitive function and elevate mood, including phosphatidylserine, bacopa, ginkgo, lion's mane, and more. Nootropics are substances that improve focus, memory, and attention, boost motivation and mood, and promote emotional and psychological resilience. They also support brain health by protecting neurons, promoting neuroplasticity, and even regenerating new brain cells. I spent over 2 years researching, developing, and testing this product. One of our early testers described the experience of taking it as turning the lights back on. She felt clear headed, focused, and alert, yet calm and grounded without the jitteriness or crashes of caffeine. She also said her mood was brighter and she felt uplifted and enlivened. This was the inspiration for calling it Luminous Mind. I designed this supplement for anyone who wants to boost their cognitive function, creativity, and mood, and support and protect their brain health. It's a perfect fit for students, knowledge workers, entrepreneurs, creators, artists, people under mental or emotional stress, and those struggling with cognitive issues, low mood, and difficulty focusing and concentrating. Think of it as an unfair advantage that can help you achieve your goals, whatever they may be. Visit adaptnaturals.com to learn more about Luminous Mind and place your first order. So let's talk a little bit about, and maybe get a little bit more specific. You mentioned some of the epigenetic testings for SNPs that you do, and let's talk a little bit more about what are the kind of most common things you're doing to support kids who are getting conventionally treated.
Yeah. So the epigenetic testing, like I said, is mandatory for me to work with a child because it allows me to see, they're good and they're bad, I guess is what I call them, SNPs. The ones that come up most commonly for kids that are very relevant through treatment. One we talk a lot about in functional medicine is MTHFR. But specifically, there's a significant association between MTHFR polymorphisms and an increased risk of methotrexate toxicity. Methotrexate is a chemotherapy that's used in a lot of leukemia treatment. ALL is the most common type of leukemia that's very curative, 98%. It's a very long treatment. But for example, if I know a child has MTHFR and a very specific polymorphism, I know that their risk for having hepatic and gastrointestinal toxicities is so much higher. So I know I'm really doubling down on what I'm doing to protect their stomach during treatment. I know that their platelets are going to fall much harder. I know that they're going to get more severe mucositis, and there's phenomenal things you can do to prevent mucositis, like photobiomodulation, so red light therapy. So MTHFR is a big one. Another one that I see come up in kiddos a lot is PON1. So individuals with this mutation have an 82% higher risk of organophosphate toxicity. And so many kids diagnosed with cancer have this PON1 epigenetic hiccup. And the beautiful thing is by just giving them quercetin, you're decreasing that toxicity by, I wrote about it in my book, it's like 148% decrease. And then we know that a big part of their overall treatment and health is going to be your sauna, right? Your sauna with binders and glyphosate testing. So those are two big ones that I look for. The things that are very important, the second half of your question, what do we do during treatment? So I'm looking at a child's labs, I'm looking at their epigenetics, and I'm looking at exactly what chemotherapies were prescribed. So this is very important. And then we know from adult studies that if we fast an adult through their IV chemotherapy infusion, that we can reduce their side effects by up to 80%. We can't fast kids because social work would get involved really quickly, but we can mimic fasting by putting them into a state of ketosis during that IV chemo infusion. And kids are so easy to put into ketosis. Like it's no big deal for them. They can almost essentially eat a normal healthy diet and you just give them a little bit of exogenous ketones and they're in
Yeah.
ketosis. So that is the one place I love ketosis as a therapy is I have all my kiddos on the day of their IV chemotherapy, so the day before, the day of, and the day after, or radiation, I have them do it through ketosis because we can not only reduce their nausea and vomiting and all the things that are happening that day, but I really believe that we're helping protect their healthy cells and potentially reducing late effects later on because 95% of pediatric cancer survivors have late effects. Also, there's very specific supplements that help specifically with the type of chemo you're on. So I'll give an example. Doxorubicin is a pro-oxidant chemotherapy. It's very toxic to the cells of the heart. It's a chemotherapy that's often used in pediatric cancer. And something as simple as grapeseed extract can reduce the potential of that toxicity now and later on in life by like 80%. Omega 3s, these have been studied in pediatric oncology patients. Just giving omega 3s through treatment is going to reduce toxicity and help malnourishment. So these aren't incredibly invasive or incredibly out of the box therapies. Some of these can be just very simple key supplements, vitamin A, D, K, omegas, and then depending on the chemotherapy, kind of more specific supplements to get them through and responding to what their body's doing. So if we see that their liver enzymes are going up, we're going to maybe pulse glutathione a little bit more. Maybe we'll use milk thistle if we can, castor oil packs. So just really working with the child individually and how they're going through treatment. And it makes a really big difference. We can actually prevent mucositis in all kids and even through bone marrow transplant. And I figured this out with my daughter. They said I couldn't do it. They said they've never seen it done. And we did it. And then we did it. Unfortunately, we've had 3 bone marrow transplants and we keep doing it. And it's simple things. I mean, it's some supplements keeping her in ketosis, and I'm in love with photobiomodulation for like everything lately, but it's phenomenal for helping prevent and heal anything going on in the mouth. So I think that's also important for parents to know. I think when they think about like a holistic or integrative oncology approach, they think we're doing really weird stuff. And some of this stuff can be very simple. And sometimes it's infuriating that it's referred to as integrative because good nutrition is not integrative. And some these supplements, there's nothing integrative about them. It's just what your child deserves to get through treatment that isn't taught or known by conventional oncology. And so they tell everybody not to do anything because they don't know.
Yeah. And, or they're not current with the scientific literature.
Not at all.
Yeah, we just went through this in a totally different context with my daughter. She had a pretty serious degloving injury, and her pinky was almost severed about halfway down in an equestrian accident. And fortunately, there was a very talented hand surgeon here who was able to reattach it. But the post-op wound care was, I would almost say, barbaric in the sense that, this is not my area of expertise, but I know how to research.
Yeah.
That's one of my superpowers, and I also know a lot of people in medicine through my history and career. And so I talked to some surgeons that I have expertise in wound care, and I went and got the latest textbook in wound healing, and the types of bandages and dressings that they were applying in the surgeon's office in the post-op visits were things that had literally been left behind in like the 1970s, at least in terms of like the textbook approach to wound care. And they were still, for example, trying to keep it dry, whereas we know that keeping it moist creates a better, I mean, you probably know this as an emergency medicine specialist, but I was shocking to me to see that people that, I mean, they were incredibly talented surgical team, and I have nothing but gratitude for their almost miraculous work in reattaching her finger, which has thrived and is still viable. So, but that's an example of how the standard of care in this case was 50 years out of date. Not
And
5 years, not 10 years, like 50 years out of date.
yeah, it's like that. I mean, my daughter was just inpatient and had a complication called TMA after a transplant. And I literally spent 5 minutes like looking it up. And I'm like, why aren't we doing N-acetylcysteine IV? And they're like, at
Yeah,
rounds, they're like, why would we've never heard of that? I'm like,
right,
here's 3 articles.
right.
Like, I want it started.
It's very disappointing when ChatGPT can give you
Yes,
better medical advice
yes,
than what the current standard of care. Because what is ChatGPT doing? It's pulling from published literature. It's
yeah,
not just, well, okay, ChatGPT can hallucinate in some
yeah,
situations. We do know that, but generally, if it's not doing it, it's pulling from the store of published human knowledge and currently available research that anybody can look up. Presumably including the
yes.
current physicians. But this is a little bit of a soapbox thing for me, as you know. It's just like I don't even necessarily blame individual clinicians because they're victims of the same system that we are, where they, this from your background in emergency medicine. A lot of primary care doctors are seeing, or even specialists are seeing, just an absurd number of patients per day. They're working, and then they go home. They have to finish all of their charting, soap notes, and they have a family and they want a life. So like, when do they have time to
Church.
come up with new protocols and do this stuff? So it's a systemic problem. Not so much a criticism of individual clinicians, but I've seen it in oncology. And when I refer patients or they come to me for supportive care, but in so many other areas of medicine as well, where there's this huge gap between what the published peer-reviewed literature is saying and what the standard of care is currently. So I mean, that was another question for me, is like, for you, is like, what has been the response generally? I know it varies a lot, but for the conventional
Mhm.
practitioners when they find out
Yeah.
that your families are working with you.
I would say for the most part, the oncologists are not open to anything. I would say that's the general consensus. Once in a while, I work virtually with patients all over the country. And so I've been able to work with some of the, what we consider, what we think of as some of the top hospitals for pediatric oncology. And it's no different there. Very closed minded, 99% of the time saying don't do anything. Once in a while, I'll run into an oncologist who wants to have other team members on and is willing to, read about the mistletoe therapy that I am like begging the family to start because it's osteosarcoma. And we have a pediatric oncology study that showed that mistletoe is 56% more effective than this chemo that they want to start, but not good. And so I feel bad for the families that work with me because I don't want to tell people to keep what we're doing a secret because there's no secret to it. I'm happy to always talk to the oncologist. But when they say don't do anything, and then you have these families who are kind of stuck in the middle, and you're asking them to either trust me, and I'm like this like girl on Zoom with no white coat on, versus this institution, right? Of like, men
Yeah,
who
it's
in coats.
scary. Hmm.
It's scary and it's intimidating, and I feel for the families because, I can only ask them to trust me, but, it's not that they don't get to know me as well as they get to know their team members, and they're just so I really try to teach families I teach them to trust their intuition. I think that's a really big part of going on any kind of journey with your child, that you are their everything, like, you are their advocate. But I have learned never to, like, I'm not gonna pressure anybody, I'm always gonna offer what I do for my daughter and, the best scientifically supported, experienced advice I know, and then it's really up to them on what to do. I think some of the like we talked about some of the simple things. Ketosis is usually overwhelming for families, but some of the simpler things, some of the simpler supplements are, I think parents can like understand. But when we get into more out of the box things, I think that's when it really takes a certain kind of parent, honestly. And I
That's
usually draw that certain kind of parent. I don't have a lot of families coming to me where I'm convincing them
right.
they're
They're just not coming to you in the first place.
exactly,
Yeah, but
exactly.
it's this is current for me because of what we just went through with my daughter. And of course, I'm someone who is not the typical person in this
Right.
regard because I have training and I've have a lot of experience going against the grain in terms of, bucking conventional wisdom, both as a patient myself, going through my own health journey and having, seeing the benefit of doing that in my own experience, and then seeing the benefit of doing that as a clinician for 15 years with thousands of patients and training doctors, et cetera. However, I am a huge advocate of common sense and intuition.
Yes.
And there's a thing that tends to happen, I've noticed, and it still happens to me despite all of that experience that I just mentioned. For example, when they were applying just big wads of gauze to her finger after the surgery instead of something like Mepitel or a silicone or a hydrogel bandage, which would be indicated by current practices and research, I have a moment of like a common sense and just objective, looking at a wound care textbook tells me this is wrong, but shouldn't they know what they're doing? This is a surgeon, like one of the top hand surgeons in Bend and his office. Surely they know, what they should be doing in this situation, because all they do is see people with wounds every single day, all day long, all throughout the year. So I would think they had looked into like the most modern approaches to wound care. You cannot make that assumption. And on the flip side, you often can trust common sense and intuition, even if you don't have a lot of domain knowledge or expertise in that area. I think that's the key thing. And the parents who probably come to you and who are able to follow through with your recommendations are the ones that are able to do that, versus, I think it's harder to do that in a situation where you don't have expertise, because you think, well, maybe there's something I'm missing and I can't trust common sense, or I can't trust my intuition in this situation. All of these experts have some knowledge that I don't have that might invalidate my common sense or intuition. Now, I'm not going to say that it's 100% reliable, but I will say in my life, reflecting, even in areas where I don't have expertise, like in wound care, the intuition and common sense are often very reliable. And if you're able to trust that, then it will take you pretty far.
Yes, and those are the kind of families, I switched and created an application to work with me because I feel like I don't want people wasting their money or time, right? When I'm gonna tell you to do all this stuff and it's gonna be too overwhelming. It takes a certain type of parent to, yeah, to be able to listen to their intuition and know that something doesn't feel right, and it doesn't require you to be an expert in that field.
Yeah. All right. So we've talked about some of the approaches during treatment, but of course, as you've experienced firsthand, and particularly this is true with many chronic conditions, but particularly with cancer, when the treatment isn't necessarily over, it comes, perhaps there's the end of the chemotherapy or whatever conventional treatment is happening, but of course, more support is needed after that in many cases. So, what does that tend to look like for you?
So, in conventional medicine, you're done with treatment. They have you ring a bell and they tell you you're done. Like the outside world celebrates and brings you, like cakes and cookies and ice cream to celebrate done,
That's
right?
another conversation
Yeah.
altogether.
Yeah. And families are often, I would say the first 6 months off treatment are almost harder than initial diagnosis because you're told everything's done, everything's good, and whether family did integrative treatment or didn't do integrative treatment, like they're just kind of left starting to freak out. Think about relapse. They have a child now who just went through all this toxic treatment. Their gut is completely ruined. Their organs are tired. The mental, emotional vibe and frequency of the whole family is completely disrupted. The HPA axis is just dysregulated. So the number one thing I tell families is that it's okay for things to just not be okay for a while. And I really refer to that mostly to the nervous system dysregulation. Everybody's dysregulated. Everybody's going to respond in their own way. Dad's going to be sad in this way. Mom's going to be sad in this way. A child, depending on their age, is going to act out this way. Um, then we talk about gut healing, gut healing, gut healing, gut healing. We need to heal that gut. And it takes years to heal a gut after most treatment. And so I teach families, what does gut healing entail? Nutrition has to be on point, and then we teach them about the importance of the different probiotics and repair complexes, and we switch them out. I don't do any gut testing on kids within the first year of being done with treatment because it's a waste of money because the gut just it looks awful. So restoring the gut because if we're not absorbing our nutrients, if we have a leaky gut, well, then we know all the symptoms we're going to continue to have. And we have so much healing to do. We can't heal if we're not going to, close up those junctions and restore the microbiome. Also detoxifying. And I know it's such a sexy word right now. Everybody's talking about detox teas and detox that. So I teach families, our body is so awesome. It's always detoxifying, but we need to kind of step things up now because we probably still have all this chemotherapy left over in our fat cells, right? Or the radiation. So we talk about gentle, right? Some of these kids are 2 years old. I mean, some of these babies are 6 months old. We talk about, sauna's a really big one for me. I don't think anything compares to sauna when it comes to detox. And then we talk about like some of the more gentle ways of detoxifying, like the rebounding. I think is cute for kiddos because it puts stress on their growing bones. And we continue all the testing. So we're gut healing, we're detoxifying, we're working on helping them emotionally. And I'm usually not a huge fan of just talk therapy. I think that it may help some people, but I feel like we get stuck just talking about our problems. So I tend to point families towards things like sound healing and nature. And depending on what state you're in, maybe microdosing and some of those things that I feel like help families more than just being a therapist and talking about the fact that they just went through cancer treatment. And then we go back to, so we're gut healing, we're detoxifying, we're working on their nervous systems. And we go back to why did your child get cancer? What were those top three things? Oh, it was their microbiome. Okay, well, we're working on gut healing. Oh, it was toxins. Okay, well, let's do toxin testing now. Let's see what those toxins were. oh, it's glyphosate. Where is it coming from? Getting air filters in your home and just really a lot of education about what we can do to make our home less toxic. Or maybe it was blood sugar dysregulation. So, really honing in on the diet and key supplements. It takes a long time for a child to heal. I would say it takes a full year from most treatment for a child to have a healthy gut, to not need like real, like every 3 month support. And then even every 6 months to a year, we do testing. So then we do gut testing, we do toxin testing, we look at all the things that help contribute to the cancer and make sure that they're not starting to creep up on us. And none of that is mentioned in conventional oncology. I mean, think about how long ago we learned about the microbiome and the fact that you can have a leaky gut. There's absolutely no reason this isn't part of care in conventional oncology. Somebody saying, you know what, we need to heal your kid's gut now.
It's the same reason that they're still putting gauze on wounds, post-op. I mean, I wrote about this in my second book on conventional medicine. It's like the image would be like a super tanker, the largest super tanker in the world, turning around. But imagine that that's happening on a time scale of years, rather than hours. And that's the situation that we're in. Unfortunately, there's so many reasons for it. And it seems so dysfunctional that, especially in something this vital and important, that there wouldn't be a mechanism for making sure that clinicians are up to date with what the latest research says. We're not talking about woo woo,
No.
completely unproven stuff here. We're talking about things that are in the published peer reviewed literature that are really not that controversial at this point, and even that are being taught in medical schools and in continuing education courses. And if you were to consult with some of the top experts in the field, they would agree with you wholeheartedly. But it's just this lack of penetration of those ideas down into the average, primary or specialty care settings that is just so enormously frustrating for patients and clinicians alike.
Yes. And 95% of kiddos who go through treatment and have survived get a late effect. And a late effect is relapse or congestive heart failure, liver disease. I mean, these are big secondary effects. And I really believe that if kids could go through treatment in a better way, and if we work on healing their guts and healing their body and detoxing and keeping an eye on them with more in-depth testing than like the random CBC they'll run. I mean, it's literally all they do. I really think we can decrease those late effects in kids, not just secondary cancers, but just all of them. They have these survivorship clinics. They call them survivorship clinics. Once you've reached, I don't know if it's 3 or 5 years, and all that could be done in these clinics. And it's literally just seeing a patient once a year, doing maybe a CBC and a CMP and maybe a heart echo and no education. And they're being told that that's what survivorship clinic is, like they're doing something, and it's not enough.
Not enough. Yeah. Well, Dagmara, thank you so much for sharing your experience and your insight and wisdom. This is such an important area of medicine that has really been neglected, as you pointed out. And there's, really not that many places to turn for parents who want to pursue a more integrative or holistic approach to cancer care for their children. And so I'm really happy that you're out there doing this work and helping people. So let everybody know where they can learn more about your work, follow what you're up to, and if they're in a situation where they might need your help, how they can do that.
Yes. So, the easiest thing is the book. My book is finally out. It's called A Parent's Guide to Childhood Cancer. So, it's on Amazon, super easy to get, and it's really a easy guide for parents. They can open any chapter to whatever phase they're in with their child. For more support, my clinic website is zuzasway.com, and we do have a few different ways and programs that they can work with me. And in June, so in a couple weeks, I'll have a pediatric oncology course coming out and a community starting where I can support parents in bigger groups and take them through a course, and just really get more into the nitty gritty of maybe some more out of the box things, than what I wrote about in the book of different ways that we can support these kids.
Excellent. Thank you so much. And thanks everybody for listening. Keep sending your questions to chriskresser.com/podcast question, and we'll talk to you next time.
Thank you so much.
That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresserlac. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.